1, we are now live. TikTok live number 85. We're going this week. Today's Sunday, November 23rd. And then I got to get back to studying. Looks like I'm skipping dinner tonight. Yikes. All right, here we go. Rowe said, oh my God, hi. I have a question as a patient. I know not medical advice. Gotcha. Got it. You know. Okay, Rowe. So what's your question? Where is it? Toucan Sam asked, didn't Dr. Qureshi kill a patient? I believe the other day I was Googling Dr. Qureshi's site, and there was some article that had to do with that. Now, I don't know. We didn't get into that on the podcast. We did talk about anesthesia risks and complications and management. So I don't know. I didn't ask him about that. But it seems like there is a topic to get into with that there are articles online, but I don't know. I think we had a great conversation on last week, if you liked it. Invader 1031 said, when will you do the next podcast with Dr. Wahan and Dr. Joe? Dr. Joe and Dr. Amir in Canada. Yeah, our back teeth boys, I guess. Hopefully soon. It was supposed to be last week, but I don't know if you saw on Instagram, Dr. Wahan, his son's going through a lot of surgeries right now. Man, oh my God, it's a sad story. And yeah, I want to take a minute to actually shout out to Dr. Wahan and his son. Moment of silence for them. Quick little prayer. Dr. Wahan and his son going through a lot right now with the surgeries and stuff. I don't want to say anymore. It's not my place, but going through a lot. And I hope his son is hanging in there tough. And I hope, after the surgeries he's going through right now, that's it. And he can just kind of, hopefully live pain-free and issue-free for as long as possible. I mean, I know Dr. Wahan's going through a lot right now. I hope he's doing okay. So shout out to him. Guys, by the way, this is Dr. Wahan's podcast, The Wahan Experiment. So shout out to him and his podcast. So give him a follow. All right, let's get into it. Let's keep going. But yeah, hopefully soon. Right now I've booked for the 2nd of, it looks like we're missing November, our podcast for November together. Oh, that's one of my alarms going off because it's already 9:04. It's my 9:04 alarm. I'll get back to it in a second. But yeah, we'll do that. Hopefully the 2nd of December, we can hit that podcast, if not a week later. But once Dr. Wahan's stuff settles down, we will. And and I want you guys to submit questions on what topics you want us to go into on that podcast episode. Where to go? VEM1, like the Lyle. JP said, any tips for getting in my first application cycle? What? Yeah, like what? Application for what? Dental school, oral surgery residency, and what tips are you looking for? You gotta give me some. Jord Horace said, I'm a pre-dental taking 2 gap years, scored a 24, pretty proud. You should be. Congrats, man. Congrats, Jord. Looking at OMFS, but the match rate, what about the match rate? Don't look at the match rate. Go to what you want. The match rate is daunting. Any advice on how hard it is to match versus how hard you work hard. You go to a dental school, work hard in dental school, get good grades, get good scores, get a good CBSE, extern, and you'll be all right. All right. Let's get you into dental school first. Let's get you at a good dental school that you'd be excited to go to, and then we'll go from there. All right. One step at a time. Rowe said, dentist said mouth is size of a 5-year-old and I need an appliance. I've had 2 palatal expanders. It's affecting my airway. Should I consult a surgeon? Well, it sounds like with the appliances you were seeing an orthodontist, right? Did the orthodontist say you should consult a surgeon? Because many times surgeons and orthodontists, we work hard to, work on the dental deformities and then skeletal deformities. And to differentiate in between the two, if you could fix some of these things with orthodontics alone, that's great. You don't need surgery, right? But then there's also those cases where you can only camouflage so much dental-wise, dental deformities, fixing that, and then you can only camouflage so much skeletal deformities with orthodontics, and then it might get upgraded into that level where you might need surgery to correct some of those skeletal deformities and correct the airway, the palate, the mouth, the size of your mouth. That's different, right? But Dave, you said best tips to get an A on OChem. Study the summer before you start taking organic chemistry. That's one thing. Chad's videos are good for organic chemistry. Khan Academy is good for organic chemistry. I would go on Quizlet. I would run through as many of those Quizlet things as possible. But also chat with ChatGPT or Grok on tips. Like I would put your PowerPoints into Grok and ChatGPT and tell it to make like a question answer format. Plug that into Quizlet. Now you got some personalized studying for your presentations. I wish I knew about Quizlet in undergrad and how to make them and utilize that, because that would have made things a lot better than just writing everything down like I did. Not smart. Elisa said, "Oh my God, hi." Hey, Elisa. Oh my God, hi. Elisa said, any recommendations for the DAT second time retaking it? Yes, DAT. You have boot camp. You have Chad's videos. You have Crack the DAT. You have what's the other DAT Destroyer. Look into those things, okay? And look online into what, because it's been 9 years. It's been 9 years since I took the DAT, right? So I don't have the best I don't have the best recommendations at this point since I've been out of that area for a while. But those are some things to look into. All right. User 1851 said, what do you think of Christiana's OMFS program? I thought very highly of Christiana. I ended up breaking them second behind NYU, and I ended up going to NYU, but I ended up ranking Christiana Care second. Yeah, I was very impressed with their program, their culture. They had residents interview the applicants. I really liked that a lot. They were good. They asked me what my OR music was, and I'd said Kygo, of like one of three people that I, music artists that I have, and they were like, yeah, we got Kygo in the OR. I like that. Kid said, I heard OMFS. Kelly said, I heard OMFS programs look down upon people doing accelerated BS D&D programs. Thoughts? I didn't hear that. Who'd you hear that from? I didn't hear that. I'm not so sure about that. Ahmed Muhammad said, I graduated as a dentist in Egypt and I wanted to specialize in maxillofacial surgery, but unfortunate what? What's unfortunate? I'll said Q&A with medical questions. Ask about OMFS programs. What? AFCJD, what's up, man? Hey, Doc, how have sedations been going? Actually, sedations have been going really, really well. Yeah, sedations have been going really well. I've been very excited to be doing them, and they've all thankfully been going really, really well. And I got this whole system I got set up where, the assistants and we work on things, and yeah, they've been going great so far. I've been doing are we at a month now? We're at a month now, and yeah. So just all good things there. I got my little cocktail of medications. I usually like to do midazolam, fentanyl, and propofol. Those are my three go-tos, and always got to check medical history of the patients prior to, right? Airway and everything, the whole evaluation, ASA. And I don't know. It's been going good. I've been having fun with sedations, and I think it's been really very helpful to a lot of patients, for them to be comfortable while taking out their wisdom teeth or other teeth for that matter. Yeah. JP said dental school. What about dental tips on applying to dental school? Yeah. So you need your DAT, you need your undergrad letters of recommendation, you need your undergrad GPA, things like that. What questions do you have specifically on applying to dental school? Arya said, what's good? Headlight options for OS procedures. My loop light doesn't feel bright enough. I like my loop light. I have a hands-free one, so I just go like this, and then the light turns on. It's got high power, low power. I use that light. It's got a big battery on it right here. And I prefer that. I prefer to use that. Yeah. Marina said, would you describe the IN as a Bucatini noodle? Inferior nerve. Yeah. I don't know what a Bucatini noodle is, but yeah, it's like a little noodle in there. Yeah. Have you seen the IN? I've seen the IN. But yeah, thanks for joining, Maria. That's funny. Big Brown Cheeks said, yeah. The the IN is the inferior nerve. That's the nerve that runs into the mantle down here, and then it comes out the mental foramen in the jaw right about here, and then it supplies sensation to the lower cheek and lip and chin, even on this side, from about the midline to the corner of the lip. That's where the mental nerve supplies. So the IN is what goes into the jaw, supplies sensation to that area, and the teeth. It's very important to avoid that. That can be very close to wisdom teeth. The inferior nerve is very close to roots of some wisdom teeth, and that's why we like to get a CBCT, a three-dimensional x-ray, to evaluate exactly where the roots are in respect to the nerve. Sometimes it's compressing it. Sometimes the nerve is running right through the middle of the roots. I've seen that. I've seen, literally going around. I've seen compression of the nerve. I've seen it all. And we want to avoid the nerve, right? We want to avoid that nerve when we're doing surgery. So that CBCT is a extremely helpful modality in order to be able to evaluate and know exactly where that nerve is before surgeries. Mm-hmm. Big Brown Cheeks said, what dental school did you go to? I went to Stony Brook Dental School. Yep. And then I went to NYU and Bellevue's oral maxillofacial surgery program, and now I'm at All County Oral Surgery. I'm at the Millville office. We got offices Brooklyn, Queens, New Hyde Park, Jericho, Lake Success, and Melville, where I'm at. And we have one in Manhattan now, Dr. Chatkins in Manhattan. So, come in and say hello. Come in and get a consult. Let's do it. Rowe said, my teeth are beautiful and straight. Can't breathe. I'm not seeing orthodontist. Dentist did airway evaluation. Your general dentist did your air. I'll go to the orthodontist. Yes, start with the orthodontist. You can definitely get a consultation with a surgeon. That can hurt. But I would for an airway evaluation, I would go to the surgeon. So consider the orthodontist. Maybe you do upgrade and go to not upgrade, but maybe you do consider getting an oral surgery consult to take a look at the airway. Yeah. Tony, did you get hospital privileges yet or not yet? Still haven't heard back. I haven't heard back from Dr. Andrew Salama of LIJ. I don't know what's going on, guys. These privileges on Long Island are just not, and they don't pay you. So what are we doing here, guys? What is going on? Yeah, I got to look into that. I got to look into the hospital privileges because that's an issue. I need to have hospital privileges to take the board exam and then get the results. And there's so much to do. On top of all the board studying I've been doing. I did 7 hours today. We had our case session. and I was setting up my Quizlets to be able to study those. That took a couple hours to make my Quizlet things to make sure I get all the question answers of the entire chapter and all the topics I need to know. No, anyway, Carissa said DAT bootcamp and do all of the practice tests over and over. Learn from the explanations. Do not spend too much time on the content review. At Elisa, that Carissa, that does sound to be pretty consistent with what I was doing when I was studying for the DAT. Just figuring it out. Hart said, hey there, what do you think about dental anesthesia residencies? I get this question a lot. I think it's good, but I think the insurance reimbursement is different for dental insurance, for dental anesthesiologists. Okay. And I know that they're kind of coupling with Dr. Qureshi talked about this on the podcast last week, that pediatrics and dental anesthesiologists are really coupling up big time there to treat kids in their clinic. Yeah. So Carissa said, Alisa, do not spend too much time on the content review, especially now that you have taken the exam already and probs already did that at least once. Mary Ain said, advice for D1 wanting to go into OMFS. Yes, for D1 year, this is very important. Don't hop, skip, and jump into CBSE studying, you're not going to see patients for a while. But in order to prepare yourself to have the opportunity to maximize your studying for the CBSE or in clinic later on, what I would recommend is, I just lost it. Yeah, so D1 want to go into OMFS. Here's what you need to do during D1 year. Before you move on to CBSE studying, before you move on to externships, you need to maximize your time for studying for everything, because D1 year, you're just getting hit by the equivalent of like 32 credits a semester compared to undergrad, right? So in order to do best to optimize your grades and scores in a 32 credit semester, I would work on efficient and effective studying. Effective studying is obviously getting C's, B's, A's, working better and better, but efficient studying is studying less and less and less, but maintaining those A's. You see what I'm saying? So you really got to work on that. The way I did it was Quizlet, getting Quizlets in and just learning how to get the repetitions and go, more reps of Quizlets. That always helps. IK Schlock said, would you say dental schools look at science GPA more than GPA? My GPA is lower than my science GPA. They might. I mean, it really depends on the school that you're applying to, right? It's going to depend on that admissions person, that person who's interviewing you. It's going to depend on them. That's a personal thing. It's definitely something you could bring up. Like, hey, my overall, because it was bad, I was taking these classes, whatever, but my science GPA is something I'm proud about, yada, yada. That's something to consider, right? You could do that on interviews. Any advice for Isaac Ramus? Any advice for students? Yep. I got a big advice for you. Got to study. Any advice for students? Yeah. What do you, for dental students? Yeah. You got to study hard. Like, what do you want me to say to that? Notification. I go to an Ivy League pass-fail school with research, volunteer, 75 EPC, 79 old score, but I only have 8 interviews and only applied to 4-year programs. Why so few interviews? I don't know. I don't know the rest of your application. Ivy League school's excellent. 75 or 79, whichever one it is. Those are great scores. They are. You only applied to 4-year programs. Maybe that's why, but I don't know. I don't know what the rest of your application looks like. You did say you did research, which is great. Research generally helps you get more 6-year interviews than 4-year. Yeah, I don't know. Maybe your letters of recommendation. I don't know. That's a good question, though, because there's a lot that goes into that application, right? Mikey Loaf said, do you use Dandy's Lab? I don't know what that is. Big Brown Cheek said, did NYU pay during residency? Yeah, all oral surgery residencies are paid. Yeah. How do other specialties get out of debt? Well, you're not getting out of debt on your oral surgery residency salary. Let me tell you, okay? When I started, it was $69,000. After taxes, it was about $45,000. Yeah, that's not, and then rent was $34,000. So it was $11,000 a year for groceries. For the first 2 years, it was about that. Yeah, that's not enough. You're not paying back your loans with that. I was barely making groceries week to week in Manhattan with that salary. This is the truth, guys. I'm telling you exactly how it is. It was exactly $69,000. After that, it was about $45,000. My rent was $34,000 a year. Yeah, that's not enough. It's not enough. My second year, my salary was bumped up to $75,000. They did like some increase or whatever. That was better, but I was still negative that year. I forget if my rent went up that year. It was the year after. My rent went up my third year, and I forget like what the difference was, but it was about $34,000 both years, and all 4 years for the most part. And yeah, so it was just it's very tight. It's very tight during residency. It does help to get paid, but it's like you're not buying a Ferrari with your residency salary. You're not living in a penthouse with your residency salary. You're literally barely making groceries each week. Rowe said, yes, my dentist did like 90 minutes of different scans and photos, and in Connecticut. I'm in Nashville. Oh, and a CT. He did a CT. You're in Nashville, Tennessee, but they did a CT scan. Yeah, I think it might be time to get a consult with an oral surgeon to have them evaluate your airway and such. Marina said, have you encountered patients that have nerve damage from cosmetic treatments like Kybella? No, I haven't encountered that. I haven't. No, just nerve with mostly with wisdom tooth extractions. I have seen, unfortunately, patients that I got wisdom tooth, I mean, anyone that's doing wisdom tooth extractions, you're going to have nerve changes just because of the proximity to both the inferior velar nerve and the lingual nerve as well, right on the other side of the lingual cortex where that third molar is on the mandible. Yeah, but I have seen more of non-specialists taking out wisdom teeth or non-oral surgeons taking out wisdom teeth. I have seen in residency. Look, I only had 4 years of experience seeing that, right? But I did see that in residency, unfortunately. Marina said, "Have you encountered patient? Was it user 1749259? Less serious note, model 3 or Y? Have to pick one. I got to be honest. I don't know the specifics to the model 3 or Y. I do want the Cybertruck, but that's because it's bulletproof. I think that'd be great to have clean, energy efficient vehicle, electric, that's safe to drive to and from work every day, bring the kids to soccer. But I want a safe vehicle. That's in a clean vehicle, electric, Dash said, I'm a D3. I want to specialize in ortho. Any tips? Yeah, ortho tends to like research. And I'm noticing it seems like orthodontics residencies, they like research. They love their high class ranks. It's very competitive. Orthodontics is very, very competitive. Rowe said, I am hesitant to get regular dentists manage this work, hence why I'm not sure if I should consult. Yeah, let's start consulting others. I think that's a good idea. Leeson said DDS versus DMD. Guys, there's no difference between DDS and DMD. Just Harvard, back in like the late 1800s, they switched from DDS to DMD, started their own thing. Some other places followed, like UPenn. Some places, even Ivy League schools like Columbia, didn't follow path. But DDS is Doctor of Dental Surgery, right? Or doctorate of dental surgery, basically. And then DMD is Doctor of Medicine and Dentistry. Guys, it's the same degree. It's just different wording. It's fine. It does make a difference, okay? Marianne said, appreciate it. You got it, Marianne. Rose said, sorry, I don't know. My questions are your lives are for. I know my questions aren't what your lives are for, but I appreciate your insight. Hey, my lives are just for answering anything I can do to help. I'm here for you. I'm here for you right now. Nakoa said, you're so fine. I cheat on my 67th boyfriend. 7th. Wow. K. Schlock said, how does a 3.5 overall GPA and 3.8 science GPA sound? I like that 3.8 science GPA. I think you're going to really have to go in on that side. You're going to have to really hone in and be proud about that on the interviews. That's what you're going to want to lean your hat on. Trolling You Now said, you find me in your bed half asleep. What are you doing to me? Pat the dentist said, the legend. What's up, Pat? How we doing? Pat, how you doing tonight? What's going on? Notification asked, how far low did you match on your rank list? I matched to NYU, and NYU ranked first. It was like NYU, then Christianacare, then VCU, and then I think Oklahoma or NUMIC, and then 6 was Montefiore, and I forget everything after that, but it was NUMIC in Oklahoma, and then Montefiore was 6th. Yeah, I could have been in Oklahoma. Imagine if I went to the 4th rank. The second was Christianacare, so that was Maryland, or Delaware. And then 3rd I ranked was VCU, so I could have been in Virginia if I went down to 3. And then maybe 4th was NUMIC in Nassau University Medical Center on Long Island. And then 5th, I think, was Oklahoma. So it could have been all over. Chances of matching to your top 5. Well, if you interview very effectively, if you do really well, then yeah, your chances of matching to top 5 would probably be pretty high, But it really depends on how you interview. Big Brown Cheek said, at least you aren't taking on more debt like other dental specialties. People already average like 400K. Yeah, no, you're right. I agree. And I'm not complaining. I'm just saying, like, you can't really put that debt equation in during residency yet. You know what I mean? You're just staying afloat through residency. You're not paying off like debt in residency unless you have a significant other that can help you kind of counterbalance that financial situation. Otherwise, you're just staying afloat. User 527384, is general dentistry worth it for its income school loan ratio? If you really like it, no matter what you do, the money will come, right? If you really like it, you enjoy it, and you want to excel at it, you're excited to go into work every day, I genuinely believe that your time will come. You know what I mean? But you got to find that you like general dentistry, that you like certain procedures in general dentistry that you're looking forward to do every day. Okay, that stuff you got to look into that. All right. A Big Brown Cheek said, tuition. Where to go? Pat the dentist said, should I quit my job and go into OS? No, dude, you got a good job. Do you like your job? Pat, I never actually asked you this. Do you enjoy like the day-to-day in the office? Because I know you have your marketing company, and God, I wish I could be with you on that. But I know you're doing your thing, and I'm a big supporter of yours. How do you like the day-to-day in the office? And then what days in the week are you working? I think you're 4 days a week, no? Or is it 5? I forget, it's 4, right? Big Brunchik said, intuition for specialty seems to usually cost at least 100K a year with everything, more or less. Yeah. Yeah, it's a lot. It's a lot. And these programs have gotten used to just charging whatever the heck they want, and they get it, right? That's a problem. You can't let these programs do that, right? We got to give more help to the people actually helping people, treating people, surgery, dentistry, medicine. We got to be giving people more help, whether it's tax breaks, I don't know, but you need to incentivize people to go into these things, right? Adam said, do you do orthognathic surgery in your office? No, you don't do orthognathic surgery in your office. Maybe in a surgical center, you can't do orthognathic surgery in your office. Most of them are done in the hospital setting. What happened to my finger? Do you pronounce the G? Yeah, orthognathic surgery. That's how you pronounce orthognathic surgery. You do pronounce the G. Riley said, PEDS residency tips. I don't know. It's usually a 2-year degree. I believe most of pediatric residencies are paid if they're in a hospital setting, if they're taking call. Yeah, it's 2 years. It's a 2-year residency program. Pediatrics is treating kids, right? Tomer said, been watching you since you were in year 2 residency. OMFS is my passion too. Wish you all the best, Doc. Thanks, Timmer. Thanks, man. And good luck. Go for it. Any questions you have, just let me know. I'm here. Michael Gonzalez said, what do you look for in a dental assistant? Good question. Someone who is ready with like the next instrument before you need it, or someone who recognizes how you like to do the surgeries or how you like to place your medications. Or, for example, I like to do something where after I put the IV in, I tape it to the person's side and just things like that, recognizing your little habits and stuff and just maximizing it, like providing for those habits to make things go smoother and efficiently, and, listening to you when you're talking a lot. Sometimes I like to teach during sedations or during procedures, like look at the blue, look at the blue on the monitor over there. That's the oxygen saturation. That's the number one thing we're looking at right now during the sedation, stuff like that, and people that do it. User 5273, which dental specialty would be most heavy on procedure? What? Heavy on what procedure? TT838 said Master Uguay or Shifu. I don't know. I don't know what's Master Uguay or Shifu. What is that? Nancy O'Connor said, so you are a maxillofacial surgeon? Yes. Have you ever done surgery on trauma patients? Yes. Mandible fractures, facial fractures, orbital fractures, all of laceration, all of it. Yep, a lot of it. Michael Gonzalez said, I want to go to oral surgery. Do it. Michael Gonzalez followed the live creator. Do it, Mike. Let's go. Tamer said, do you think it's almost impossible for international graduate dentists to get into OMFS in the year? No, it's not. It's not impossible. It is difficult. It's a long way, but yeah, you can do it. You can definitely do it. User 91780. How do you feel about wisdom tooth removal? Should they almost always be extracted? No, not always. Not always. It depends on the evaluation. Are they functional? Can you adequately clean them? Are they not causing bone loss on the distal of the second molar? Are they causing pain? Are they? It depends. It depends on so many different things. Yeah. Jacob said, I have a 530 over 27 academic average, 480 over 24 on the PAT, and a 4.0 applying suit. I'm scared about seeming robotic. How to stand out? Have some unique things on your application. That all these sound really good. I don't know this new score, this new 3-number score. I don't know that, but you see 27 and 24. Got it. Very good scores. Very strong academically. Get some things on your CV that are unique to you. Like for me, playing the violin, that was really unique. And people like to ask me about that on my residency application. Could be doing research, could be doing clubs. Maybe you're president of the cooking club, whatever it is. But that's going to make you stand out on your application, something that you could relate to the interviewer with, Troll emoji said, I'm getting my wisdom tooth out next week. Any tips? I'm scared. Yeah. So follow all the directions prior to the surgery. And then to prevent dry sockets, make sure you follow the directions afterwards, right? So no spinning, no rinsing, no drinking through straws, no smoking, no bending down to pick anything up really heavy, things like that. Follow those things, okay? You're going to want to ice for the first 2 days after surgery, and then you could switch to heat if you'd like after, about day 3 and later. Otherwise, soft mushy foods after that, like mashed potatoes, ice cream, yogurt, soup at room temperature, nothing too hot or spicy, things like that, okay? Making sure you're icing. You're going to get pain medications to control any pain after the procedure and stuff like that, all right? Good luck, friend. Michael Gonzalez, I'm currently a pediatric dental assistant. Nice. Oh, that's a lot with the pediatrics, right? But you work in the hospital, Mike. Excellent. That's a lot. I don't like working in the hospital, man. I did not enjoy that. I Huff Freon said, buddy pulled shoulder out of the socket trying to apply the what? Notification asked, how many places did you interview at? I interviewed for oral surgery residency or dental school. For dental school, I interviewed at Stony Brook, NYU, Toro, Buffalo, and Rutgers. 5 or 6. I didn't get the interview at Florida. I have family down there, but they interview like 95+% in state, so I didn't get that. Oh well. And how many It was 14 or 15 interviews for oral surgery. Yeah. Troll said, I'm getting a wisdom to. Oh, we just answered that. Yeah. Troll said, thank you. You got it, Troll. You got it. Tamer said, are there any tuition paid during residency, or you just get paid little money? Yeah. You get paid. Is there tuition? Some residencies require tuition to be paid. Yeah. And if you go to the medical school, most medical schools require tuition payment if you're an oral surgery residency. Yeah. User 52738. What do you think about the new big beautiful bill? How it impacts students? I don't know. We're going to have to see. I mean, I could totally see on both sides. It could be restricting students from getting loans that they need to apply to schools, that they need to go to schools, right? That could be tough. That could be difficult, right? But on the other hand, on another perspective to look at it is like these institutions have just been increasing tuition without any checks and balances. They just get whatever they want. And it seems to be that this might start to put a strain on these schools, keep them in check. You can't just keep increasing the tuition by thousands and thousands every single year. So I don't know. I don't know what the impact is going to be. But yeah, it's a tough situation. I know. Al said, no, Al. Michael Gonzalez said, ooh, I love the hospital. Yeah, the hospital's got a lot going. It's busy. It can be fun. It can be fun if you're in a good environment. You're in a good hospital where people have a good culture, good attitude. It said, any advice for an M3 about to do research year and then apply to ENT? Just apply, dude. Just apply. Go for it. Venny572 said, Brendan, I hope you're doing good. I remember you from the city hospital. You're a great guy. Oh, thanks, man. How are you doing? How's it going? Where are you at right now? Are you working there in the city hospital in Manhattan? Marky GTM said, are you going to still take hospital call? We'll see. I think I'm going to have to this year. So we'll see how that goes. I got to get my hospital privileges, and then they want me to take call. So I will until, I don't know. We'll see. We got to see. Are they going to pay me to take call? Because I don't think they are on Long Island. I have to pay to take call on Long Island. That's essentially what it comes down to. Yeah, that's what it's looking like. Nancy O'Connor said, Dr. Justin Au did my implants in WNY, Chester, New York, maybe. He was incredible, long time out of school and residency, very tough. Yeah, it can be long. It can be a lot. All right, guys, last couple questions, then I'm gonna sign off. TikTok Live number 85 we're at now. 85. Top 5 listeners that stay on. I'm giving you guys a shout out in the caption. I'll be putting that caption in the YouTube, the podcast, the full-length recording. I'll try and get that up this week. It's 9:32 right now, so I'll probably go sign off, get some more studying in, and then ready for tomorrow. All right, guys. Thanks for coming on. TikTok Live number 85. And yeah, top 5 listeners. I'll be giving you guys a shout-out in the podcast, in the caption of the podcast on YouTube. User 44249. Should I take my CBCT if I don't feel 100%? Yes, I think you should take that CBCT. You have 6 tries to take it, so if you take it twice, D1 year, twice, D2 year, twice, D3 year, you hit it. Right? So Hassan, follow the live creator. Thanks, man. Thanks, Hassan. Rowe said, thanks, Doc. You got it, Rowe. Good luck. All right, guys. Have a good night. Let's make it a great week. And this is the last TikTok Live before Thanksgiving. So happy Thanksgiving, everyone. All right. Spend some time with loved ones. Good night.